Alright, let's make studying a bit more interesting. I'm going to do live questions of the 5-week of cardio block that we just did, and let's see how many questions I can get right. Hopefully I don't have to take any breaks or refer to any of my notes. So let's get to it. 6-year-old man presents to the ED complaining of severe chest pain, shortness of breath and feeling sweaty. He has a medical history of hypertension and smoking. ECG shows ST segment elevation in the anterior leads, and he's transferred for percutaneous coronary intervention. The patient has a cardiac arrest and dies 12 hours after his initial presentation. A pathologist decides to perform a histological analysis of the patient's heart. What pathological findings would he most likely occur? So, if the person is having severe chest pain, shortness of breath, sweaty, history of hypertension and smoking, and the ECG showing an ST elevation in the anterior leads, I'm thinking MI, as STEMI in particular. And he's had the intervention done, which means the death, I'm thinking, could be a result of the complication of a heart attack. Now, it has the time stamp, which is 12 hours afterwards. So I'm thinking, what are the different complications that can arise after a certain time period after a heart attack? Now, depending on the time frame, there are different complications. Now, within 24 hours, as a ballpark figure, you have arrhythmias that can arise as a result. Now, this particular question is asking for the cellular changes that arises as a result of this. So you're going to have to think about the processes that happens at the cardiac myocyte level when an MI happens, things that are happening afterwards. So we can split this time frame into several blocks. So I think we learned about 6 or 7 blocks. So the first part is the first 4 hours, and then 4 to 12 hours, and then 12 to 24 hours, and then it keeps going on through other stages. It actually starts with these contraction bands, but since it's 12 hours, we're kind of interested in the 4 to 12 hours and the 12 to 24 hours. So in the first 4 to 12 hours, you get coagulative necrosis and these myofibers forming those contraction bands that I was talking about. And it comes in with, and on a histological slide, you can see it as these wavy bands. So that's the kind of option that I'm going to look for. Let's have a look. So early coagulative necrosis, so that's the one that we were talking about. But let's submit and see what our answer is, which is correct. Cool, and this is a high yield textbook, obviously. And they've put down a nice summary of where these things can actually happen. Cool, next question. An 86-year-old female presents to the GP with worsening shortness of breath secondary to heart failure. The GP decided to prescribe her a diuretic something. What is the, it's a thiazide, that's the important part. What is the mechanism of action of this drug? So thiazides are diuretics, as it says over there. So they help you pee out a lot more. So you're reducing the blood volume, so it kind of decreases your blood pressure and the load on the heart. So in terms of diuretics, there can be 3 types. You can have thiazide, thiazide-like, and potassium loop diuretics. Now, we personally haven't been taught about this particular drug, so it's harder for me to say what exactly it is, but I think that this could be the third option, which is blocks the NaCl co-transporter in the distal convoluted tubule. But I want to see what happens if you click the wrong answer. Now let's have a click at the acts as an osmotic diuretic, see what happens. Okay, so it tells you the number of people that have selected a particular answer option. So for the one that I selected, 3% have done, but the right answer, which is the third one, 75% of people did. And it also shows you a lot more information about how the drugs can work and a few videos to go along and help with that, which is quite handy. Next question. 45-year-old man arrives to the AD with severe tearing chest pain. we're thinking of aortic dissection now. A diagnosis of aortic dissection is suspected. There you go. So between which layers is the blood most likely to be flowing between? So for an aortic dissection, what actually happens is that the intima, tunica intima, the innermost layer of the arterial wall, is damaged and kind of flaps over, and the blood goes in through that gap and gets collected into the media. So it's between the tunica intima and the tunica media. So select that one. There we go. That's correct. Next question. 68-year-old man with a history of hypertension presents to the clinic complaining of palpitations, irregular heartbeat, ECG performed revealing atrial fibrillation. What best describes the underlying mechanism for this patient's presentation? The patient has hypertension, has palpitations, irregular heartbeat. So the atrial fibrillation is causing the palpitations and the irregular heartbeat. So the underlying mechanism is because the SA node on top of the atria, the right atrium, isn't depolarizing in a regular rate, causing those irregular heartbeats. So we're going to have a read of these options. So the last one, regular electrical impulses from the sinus node, that's conducted too rapidly through the ventricles. That's called talking about VT, which is ventricular tachycardia, which is not really what this is about. So I got this one wrong, but let's have a look. Apparent electrical activity between the pulmonary veins of the left atrium overwhelms the regular impulses from the AV node. I didn't know this. So I want to see why the one that I selected is wrong. Decreased activity could potentially lead to sinus bradycardia, which is characterized by slow regular heart rate. It's usually below 60 beats per minute. Right, so it's more to do with the way that the answer option is worded. That's okay. Just shows that, I can get questions wrong as well.